Gentlemen over 60, listen closely. If you wake up and notice that morning erections are weaker than they used to be, or they have disappeared completely, it can feel deeply personal. You may wonder if this is simply what aging looks like. But don't jump to that conclusion. A change in erections does not automatically mean your sex life is over. It does not mean you are less of a man. And it certainly does not mean your body has given up on you. What it can mean is that your body needs attention. Morning erections depend on several things working together: healthy blood flow, nerve signals, sleep quality, hormone balance, stress levels, medications, and overall cardiovascular health. When one of those systems slows down, your erections may change too. And for some men, that change is actually an early signal worth listening to. Before we go further, remember this: persistent erection changes should be discussed with a qualified doctor or urologist, especially if you have diabetes, high blood pressure, heart disease, pelvic surgery, low testosterone symptoms, or you take medications that may affect sexual function. Now, there are two areas many men overlook completely. Not magic pressure points, not instant cures, but two areas connected to circulation, tension, movement, and pelvic health. The first area is your pelvic floor. This is the group of muscles at the base of your pelvis, the region between the scrotum and anus. These muscles help support bladder control, ejaculation, and erection quality. But after years of sitting, stress, poor posture, and inactivity, they can become either weak or overly tight. And both can create problems. Some men assume they need to squeeze these muscles harder. Sometimes that helps, but not always. If the pelvic floor is already tense, constantly clenching may make things worse. Instead, begin with awareness. Sit comfortably on a folded towel or cushion. Let your shoulders drop. Breathe slowly into your lower belly. As you inhale, allow your abdomen and pelvic area to soften. As you exhale, do not force anything, just relax. Give yourself 3 to 5 minutes. You are not trying to create an erection. You are teaching your nervous system that it is safe to relax. That matters more than most men realize. Stress, anxiety, and frustration can keep the body in a constant fight-or-flight state. But erections work best when the body feels calm, rested, and safe. The second area is the inner hip and upper thigh. This is where long hours of sitting can quietly affect mobility and circulation. Tight hip flexors, stiff inner thighs, and limited movement do not directly cause erectile dysfunction on their own, but they can contribute to a sedentary pattern that affects the lower body as a whole. Try this instead of aggressive pressure. Stand beside a chair or bed for balance. Take a wider stance than usual. Shift your weight gently from one side to the other. Then stretch each inner thigh lightly. No pain, no forcing, no bouncing. You can also take a 10-minute walk after meals. That simple habit may sound too ordinary, but regular walking supports blood sugar control, circulation, heart health, weight management, and mood, and all of those things are connected to sexual function. Here's the part many men don't want to hear. Erections are often a vascular issue before they become a bedroom issue. The blood vessels in the penis are smaller than the vessels around the heart, so when blood flow becomes less efficient, erection changes may show up early. That is why ignoring the problem is not always the best move. Talk to your doctor, check your blood pressure, ask about cholesterol, blood sugar, testosterone, if appropriate, sleep apnea, and medication side effects. If you smoke, getting help to quit may be one of the strongest decisions you can make for your circulation and your erections. Then build a few daily habits that support your body. First, protect your sleep. Poor sleep can reduce testosterone and interfere with normal nighttime erections. Second, drink water consistently throughout the day. Dehydration will not cause erectile dysfunction by itself, but your circulation works better when your body is properly hydrated. Third, reduce heavy alcohol use and late-night sugar. Both can interfere with sleep, blood sugar, and vascular health. And finally, move your body every day. Walk, stretch. Use light resistance training if your doctor says it is safe. Your body responds to regular use. You are not broken. You may simply be receiving a message from your body that it needs more care than it did 20 years ago. Start small, breathe deeply, loosen the tension in your pelvic area, move your hips and legs, improve your sleep. Get checked if the changes continue. Vitality after 60 is not about pretending you are 25 again. It is about taking your health seriously enough to give your body a real chance to respond.